Krista. I'm going to be your nurse today. I understand that you have some burning with urination. How long has that been going on?
Pain started yesterday.
Okay, do you have any urgency or incontinence with it?
Yes, and that's been going on for a few days.
Okay, are you having pain right now?
Not right now, just when I try to pee.
Okay, can you describe the pain for me?
It burns really bad.
Okay. Can you give that pain a number between 0 and 10, 10 being the worst pain you've ever experienced?
About a 7.
I'm going to do a quick assessment on you, and I've got a few more questions for you. Okay. Now listen to your lungs and your heart. Okay. I'm going to take a look at your belly. Just going to listen. So can you tell me about your living situation?
Well, I live by myself, with my dog, Gus.
Okay.
Yeah. He's a little terrier. He's very energetic.
Okay.
He likes to run around in circles around my ankles.
Oh, wow.
Mm-hmm.
What about, do you have anyone that comes and helps you at your house?
My daughter, Harper, she comes a couple times a week to help me out.
Okay. I'm really glad to hear that, Mrs. White. We're going to need to get a urine sample. Are you able to get up and do that yourself, or do you need some assistance?
Well, I have Parkinson's, so I'm a little bit unsteady.
Okay.
And then my medications make me feel woozy at times, so I'm going to need your help.
Okay, with the wooziness, I suggest you sit up and stand up slowly so that your blood pressure can regulate, because it can cause your blood pressure to drop when you change positions. And I'd like to use an ambulation belt when you get up when I help you, just to keep us both safe. Okay. I'll just put this around your waist. Stand up. Just gonna hold that here, okay? Oh, you smell like normal. Okay, I notice your head's looking down at the ground. I'd like you to kind of lift it up and look ahead of you. Okay. That'll help make you a little steadier on your feet.
Hey, how's it going?
Oh, I'm doing really good. I have this really sweet patient in room 2 who has a UTI. I'm really concerned that she's a risk for falling.
Oh, what is concerning you about?
Well, with her UTI, she's definitely having urgency with urination, and then she has Parkinson's, so she has that shuffling gait, and definitely is stooped over and looking at the ground when she's walking. So I encouraged her to look up, but definitely when you're not looking for it, you get a little unsteady on your feet.
What medications is she on for her Parkinson?
She's on carbidopa, levodopa, and then she also has depression and anxiety, so she's on bupropion and meprobate. She mentioned that she gets a little dizzy from the meds, so I talked to her about sitting up slowly and standing up slowly so her blood pressure can regulate. But another thing that made me concerned was she lives by herself and with a little dog who runs around her feet.
Yeah, I can see why you're so concerned. Have you thought about talking with the doctor to get some things switched, or?
Yeah, I think reviewing the meds would make sense, but I think first we need to deal with the UTI, of course. And it looks like her labs just came up and she's got elevated white blood cells and her UA was positive for bacteria. So we definitely need to get her feeling better. It looks like Dr. Vasquez came in and talked to you about your treatment plan. Can you tell me what he said?
Yeah, he said he was going to give me some medicine to help fight off the infection.
Okay.
And he also said that it might take 1 or 2 days until I started feeling better.
Okay, I'm glad he explained that to you. So one thing I'm concerned about is your risk for fall, especially in the next few days while you're still fighting the infection. So I'd like to talk to you about some things that can keep you safe.
Okay. I think you're right. I have been feeling unsteady lately. I didn't realize that an infection could do that too.
Yeah. One thing you mentioned was that you have to go to the restroom really urgently, and so that could cause you to rush, which can increase your risk of tripping or falling on your way to the bathroom. So one thing you might consider is getting some of those adult briefs so that you can catch any incontinence and then you don't have to rush as quickly to the toilet.
Okay. Yeah, I have been pushing myself more than normal, so I'll consider that.
Okay, you also mentioned that you have a dog that runs under your feet and around. Concerned about you potentially tripping over him when you're walking to the restroom. Do you have any thoughts on how you could decrease that risk?
Well, I was thinking I would put him in the kennel at night because the other night I woke up to go to the bathroom in the middle of the night and he just came out and he scared me half to death.
Okay. Another thing you might consider is putting a nightlight in your hallway so that you can see where you're stepping when you're going to the restroom in the middle of the night. I'd also suggest you remove any rugs or loose things on the floor so that you don't accidentally trip on them.
Okay. I think that's a good idea. My daughter's gonna come pick me up, so I'll ask her to help me with that.
Okay, if you're willing, I'd love to talk to your daughter when she gets here about some things that she can also do to help keep you safe.
Of course.
Okay, I'm gonna go ahead and get your prescription and paperwork ready. Can you turn on your call bell when your daughter gets here?
Okay. Thank you.
Make sure your bed's locked, got your call bell, it's on low. All right.